Alright, my name is Brandon Boudreau. I'm doing a 5-minute how-to video on starting an IV for my EMS related topic. First things first, I'll go over the equipment. I'll actually start an IV and then I'll bring it all back together and tell you a conclusion. Alright, we have, here in Pompano, we have 6 different kinds of IV catheters, or one kind, but 6 different sizes. We have a 14 gauge, which is an orange package. We have a 16 gauge, which is gray. Commonly used 18 gauge, which is green. The second commonly used, pink, for 20 gauge. And then we have our smaller needles, so 22 gauge is blue, and the 24 gauge is a yellow. The actual IV start kit, we have a VenaGuard to go over the site to keep it in place and keep it sterile. 2 pieces of 4x4 cloth, 1 venous constricting band. We have 1-inch tape, a pre-filled 10cc syringe, 1 map, 1 IV needle, and we have an alcohol pad used to clean the site. First things first, you want to come over, get everything ready to where you want it to be. And of course I would have gloves on for this whole thing. Put on my venous constricting band. Let all the blood go and settle. Start up my kit. Add these 2 together. Flush that system through. Put that right there, so when I need it, it's ready. Get my 2-inch tape, or my 1-inch tape, and my 4x4s. Hang that there. Get my VenaGuard ready. Alright, after waiting a couple seconds, I'm going to try and find myself a good site. Right here I have a good AC. So I'm going to prepare the arm, use my alcohol pad, clean it down, make sure it's nice and clean. Throw that off to the side into the garbage can. Open up my IV needle. Twist my catheter so I know that it's good and ready to go. Find my vein right in there. Now I'm going to go in close to parallel with the vein. Go in nice and quick. Wait for my flash. Thread the catheter in there. Hold pressure. Retract my needle. Undo my venous constricting band. And then attach my map. Keeping it there in place. I'm going to pull back, make sure I get blood, which I do, so I know I have a good line. I'm going to go ahead, flush the system, make sure there's no puffiness or swelling, which would indicate a blown vein. Push the whole thing in there. Attach my VenaGuard while holding pressure onto the IV so that it doesn't come loose. Make sure it's on there nice and tight. Pat it all down. Throw that into a sharps container. Remove my 10cc syringe. Attach a piece of tape. Make sure that's secured. Take all my trash. Throw it into garbage can so I have a clean truck. And now from here I can either push a drug straight from the IV port, or I can come over here, just attach my bag right straight to it. Throw my cap in the garbage can. Use an alcohol pad, clean down the site of the map so that there's no bacteria or anything getting in there. And then now I would tape that down and flow it in. And now a different thing that we use on our catheters, you see how up close there's these stripes? This is new for this certain kind of catheter. I'll open it up. On here, the hub in here is extended so that as soon as you get your flash and you thread the catheter in there, there's a little one-way valve that'll keep the blood in there so you can retract the needle so you don't have to hold any pressure. The old ones over there, they don't have the stripes, so you know on the container it's the old one. you would actually have to hold pressure to where that is, and then retract the needle, and then hold your map in there. These new ones, you don't have to do that because of the little one-way valve in there. And that's how you start an IV. Thank you.